Hello and welcome. I'm Ramesh Ramachandran and you're watching Newsnight on DD News and DD India, your prime-time destination for news and bespoke analysis. It's good to have you again with us. All right, on the show tonight, India steps up its fight against the coronavirus. Now, Prime Minister Narendra Modi reviews the situation in 10 states of the country, asks the states to supplement India's three-pronged strategy of test, trace and treat with two more actions: containment and surveillance. We give you the lowdown on the government's roadmap to break the chain and beat the coronavirus. Also on the show, President Vladimir Putin's daughter gets a dose of what Moscow claims is the first coronavirus vaccine to be officially registered anywhere in the world. Plus, news and updates from India and around the world. But first, as always, the headlines. Prime Minister Narendra Modi discusses COVID-19 situation with chief ministers of 10 states, says role of each and every state is significant in the overall control of the spread of the disease. Decreasing fatality rate and rising recovery rate indicates the measures being taken by India are in the right direction. Prime Minister Modi says containment, contact tracing and surveillance are the only means of getting a grip on the coronavirus outbreak. Stresses on the need to trace and test all those who had come in contact with an infected person within 72 hours. Recounts experience of Home Minister Amit Shah in preparing a roadmap for tackling the pandemic together with Delhi and nearby states. India's situation in the battle against COVID-19 is more strong than before. Recovery rate touches nearly 70%. The number of recoveries nears 16 lakh. Death rate falls further to 1.99%. In the battle against COVID-19, work on 3 vaccines going on in different phases in India. A key meeting on vaccine on Wednesday. President Vladimir Putin of Russia announces the first vaccine against COVID-19, says this vaccine develops permanent immunity in an effective manner. The Defence Ministry takes another crucial step in its self-reliant India campaign. The Defence Acquisition Council approves the purchase of equipment worth 8,722 crore rupees for the Army, approves 106 basic trainer aircraft for the Air Force as well. Vice President M. Venkaiah Naidu completes 3 years in office. President Ramnath Kovind extends his greetings. Defence Minister Rajnath Singh and Union Information and Broadcasting Minister Prakash Javadekar release a coffee table book on the occasion. No let-up in the Bihar flood situation. Nearly 74 lakh people affected in 16 districts. Several rivers in spate. Death toll in landslide at Idukki in Kerala rises to 52. Union Food and Consumer Affairs Minister Ramvilas Paswan appeals to state governments to provide ration to homes in flood-affected areas. And famous poet Rahat Indori dies of a heart attack during treatment for COVID-19. Defence Minister Rajnath Singh and Madhya Pradesh Chief Minister Shivraj Singh Chauhan condole his death. All right, let me dive straight into our cover story. On Tuesday, Prime Minister Narendra Modi discussed about the COVID-19 pandemic with chief ministers or their nominees of 10 states. These 10 states together account for 80% of all COVID-19 cases in the country. Here's a detailed report. India's success in combating COVID-19 can be attributed in no small measure to doctors and health workers, besides the coordinated efforts between the union and state governments. And Prime Minister Narendra Modi has himself been in touch with the states for drawing up a nationwide strategy to contain the spread of the coronavirus. On Tuesday, the Prime Minister held a video conference with chief ministers of 10 states that have together accounted for 80% of the COVID-19 cases in the country. The Prime Minister praised Team India for working in unison to fight against the coronavirus.
मुझे संतोष है कि हर राज्य अपने अपने स्तर पर महामारी के खिलाफ लड़ाई लड़ रहा है और चाहे केंद्र सरकार हो चाहे राज्य सरकार हो, हम अनुभव कर रहे हैं कि हम लगातार एक टीम बनकर के काम कर पा रहे हैं और यही टीम स्पिरिट जो है वो एक परिणाम लाने में हम सफल हुए हैं.
The 10 states are Andhra Pradesh, Karnataka, Tamil Nadu, West Bengal, Maharashtra, Punjab, Bihar, Gujarat, Telangana and Uttar Pradesh. The Prime Minister said, if these 10 states perform well, India will emerge victorious in its fight against COVID-19.
80% एक्टिव केसेस हम जो आज मिले हैं इन 10 राज्यों में है और इसलिए कोरोना के खिलाफ लड़ाई में इन सभी राज्यों की भूमिका बहुत बड़ी हो जाती है. आज देश में एक्टिव केसेस 6 लाख से ज्यादा हो चुके हैं, जिनमें से ज्यादातर मामले हमारे इन 10 राज्यों में ही है.
The Prime Minister called for more tests in the states of Bihar, Gujarat, Uttar Pradesh, West Bengal and Telangana. He said, containment, contact tracing and surveillance are the only means of getting a grip on the coronavirus outbreak. He emphasized on the need to trace and test all those who had come in contact with an infected person within 72 hours.
एक नया मंत्र हमें बराबर पहुंचाना पड़ेगा और वो है 72 घंटे में जिसको भी हुआ है उसके आसपास के सबको उसका टेस्टिंग हो जाना चाहिए, उनका ट्रेसिंग होना चाहिए, उनके लिए जो आवश्यक है वो व्यवस्था होनी चाहिए. अगर ये 72 घंटे वाली फॉर्मूला पर हम बल देते हैं तो आप मानिए कि बाकी जो जो चीजें हैं उसके साथ अब इसको जोड़ देना है कि 72 घंटे के भीतर भीतर इन सारे कामों को कर लेना है.
The Prime Minister recounted the experience of the Home Minister Amit Shah in preparing a roadmap for tackling the pandemic together with Delhi and nearby states. He said the main pillars of this strategy were segregation of containment zones and focus on screening, especially of those in high-risk category, and the results of these steps were there for all to see. Steps such as better management in hospitals and increasing ICU beds also proved very helpful. The Prime Minister said the number of daily tests has reached almost 7 lakh and was increasing continuously, which has helped in early identification and containment. The average fatality rate was amongst the lowest in the world and was continuously going down. The percentage of active cases was reducing while the recovery rate was increasing. He said the government was aiming to bring down the fatality rate below 1%.
72 घंटे में सारे कांटेक्ट पर्सन को तक पहुंच करके उनकी व्यवस्था करना, इन मंत्रों को लेकर के अगर हम थोड़ा फोकस एक्टिविटी करेंगे तो हमारे जो 10 राज्य जहां पर 80% केसेस हैं, हमारे 10 राज्य जहां 82% मृत्यु हैं, हम 10 राज्य इस पूरी स्थिति को पलट सकते हैं. हम 10 राज्य मिलकर के हम भारत को विजयी बना सकते हैं और मुझे विश्वास है कि हम इस काम को कर पाएंगे.
Defense Minister Rajnath Singh said the World Health Organization has praised India's efforts to combat COVID-19. For their part, the chief ministers of the 10 states recounted efforts made by the respective governments. They thanked the union government for cooperating with the states in the fight against the coronavirus. With Sudhakar Das in New Delhi, Bureau Report, DD India. Now, some people wonder, what is India doing differently that its recovery rate is high and death rate is low? Find out in the next report. India is making consistent progress in containing the spread of the coronavirus. The rate of recovery from COVID-19 has touched 70%. The number of people who recovered from the disease was nearing 16 lakh. 48,000 people have recovered in the last 24 hours alone.
15,83,000 पेशेंट्स हैं जो रिकवर हो चुके हैं। ये एक बहुत बड़ा उपलब्धि है और ये इस कारण से हुआ है कि हमारे क्लिनिकल प्रोटोकॉल एफिशिएंटली इम्प्लीमेंट किए जा रहे हैं। हमारे डॉक्टर्स और पैरामेडिक्स सिंसियरिटी से, परिश्रम से, लगन से कार्य कर रहे हैं। उनमें से अनेक लोग भी संक्रमण का शिकार हुए हैं और रिकवर हुए हैं और रिकवर होने के बाद फिर से मरीजों की सेवा में जुट गए हैं। ये अपने आप में एक बहुत बड़ी बात है।
The number of active COVID-19 cases in India is 6.39 lakh, which is 28% of the total cases reported so far. A high recovery rate means that the difference between the number of active cases and the number of people who have recovered is 9.5 lakh. India's three-pronged strategy of test, trace and treat was delivering results. One tangible outcome of this strategy is that the mortality rate has dropped to 1.99%.
एक्टिव केस आज की तारीख में कुल केसेस के लगभग 28% हो गए हैं और निरंतर घट रहे हैं। जैसा मैंने पहले आपको कहा था कि क्योंकि क्लिनिकल मैनेजमेंट बेहतर हुआ है, एफिशिएंट हुआ है, इसलिए जो रिकवरी की प्रतिशत दर है वो भी बढ़ रही है और अभी हम 69.80% रिकवरी दिखा रहे हैं, यानी ऑलमोस्ट 70% रिकवरी है। अनेक राज्य ऐसे हैं जिनकी राष्ट्रीय औसत से अधिक रिकवरी की दर है।
That is not all. India is also working overtime to develop an indigenous vaccine for COVID-19. A committee headed by Niti Aayog member Dr. V.K. Paul would meet on 12th August to discuss about vaccine research and development and issues related to it. The committee would reach out to all stakeholders, including state governments and pharmaceutical companies. Public and private sectors are working hand in hand on conducting human trials of potential vaccines.
भारत में एक कुल 3 प्रकार की वैक्सीन्स पर अलग अलग स्तरों पर काम चल रहा है। केंद्र सरकार ने एक नेशनल एक्सपर्ट ग्रुप ऑन वैक्सीन एडमिनिस्ट्रेशन का गठन किया है, जिसकी बैठक कल निर्धारित है। इस नेशनल एक्सपर्ट ग्रुप ऑन वैक्सीन एडमिनिस्ट्रेशन की अध्यक्षता नीति आयोग के मेंबर हेल्थ करते हैं और इसकी जो सह अध्यक्ष हैं वो सचिव स्वास्थ्य और परिवार कल्याण मंत्रालय भारत सरकार हैं। ये जो एक्सपर्ट ग्रुप है ये सभी राज्य सरकारों के साथ और भारत में जो वैक्सीन मैन्युफैक्चरर्स हैं उनके साथ भी अपने एंगेजमेंट जारी रखेगा।
The Arogya Setu app developed by the Indian government has played a stellar role too. The number of people using this app has swelled beyond 15 crore. The app makes a user aware of the risks of COVID-19 infection and whether they have come in contact with a COVID-positive person or not. Bureau Report, DD India. All right, shifting focus to Russia, where President Vladimir Putin on Tuesday announced that Russia has developed the world's first vaccine against COVID-19 that works quite effectively and forms a stable immunity against the disease, as he disclosed that one of his daughters has already been vaccinated. Now, Putin's claim has come amidst concerns raised by experts about the speed of Russia's work, suggesting that researchers might be cutting corners. Putin said that one of his daughters had tested a Russian COVID-19 vaccine on herself and that she's feeling well. He said the first Russian COVID-19 vaccine forms stable cell and antibody immunity. The vaccine has been named Sputnik V. The name is a reference to the surprise 1957 launch of the world's first satellite by the Soviet Union. Meanwhile, the World Health Organization and Russian health authorities are discussing about a process for a possible WHO pre-qualification for its newly approved COVID-19 vaccine. Meanwhile, the United States has said that it's more important to have a safe and effective vaccine against the coronavirus than to be the first to produce a vaccine. The White House counselor has expressed skepticism about the testing backing up Russia's claim that it has developed a COVID-19 vaccine.
Other Sputnik moment, and indeed the vaccine has even been named Sputnik 5 after the first satellite to be launched into outer space. It's been registered, the first vaccine in the world against COVID-19 to be registered, and Vladimir Putin, the Russian president, says that it has been proven to be effective and safe. It's gone through all the necessary checks, and even his daughter has been inoculated with this vaccine. But that comes despite warnings from epidemiologists that it's simply too soon to know whether or not this is a safe and effective vaccine, because the data for the clinical trials has not yet been published. We don't even know how many volunteers have taken part in the clinical trials. And phase 3, where the vaccine is rolled out to the wider public to be tested in a wider range of people, is still underway. And there have been accusations that this is pure propaganda, that they're moving simply too quickly and accelerating the registration process just to be the first in the world to register a vaccine against COVID-19.
All right, let me break it down for you. They say numbers don't lie, and here's why. Take a look at the first graphic we have prepared just for you. Take a look at these numbers. Now, India has so far conducted 2.5 crore tests. Yes, 2.5 crore. That's more than the population of some countries. And the highest number of tests in one single day was more than 7 lakh. In fact, 7,19,364 tests in one single day. Let's now switch attention to the number of recoveries. Now, number of people who have recovered has crossed 15 lakh. In fact, it's touching 16 lakh as we speak. Now, the highest per day recovery, that's in a single day, is more than 54,000. In fact, it's 54,859. Now to the third metric, that's the death rate. The fatality rate is below 2%. In fact, to be precise, 1.99%. India aims to make it further drop to less than 1%. Right, now the next graphic we have prepared just for you. Now this shows the 24 states and union territories who have conducted more than the national average of tests per million population. Now the India average is about 18,000 tests, and the states, the 24 states and UTs have consistently performed better, and Goa has performed the best at more than 94,000 tests per million population. That's above the national average of about 18,000 and plus. Now to the second graphic we have prepared, and that shows another metric. Now this shows all those states and UTs performing more than 140 tests per day per million population. Now take a look at these figures. Chhattisgarh, Himachal Pradesh going all the way up to Goa again for the second time in a row with 1,577. That's the states and UTs performing more than 140 tests per day per million population. Right, now to the next graph that we have prepared just for you. This shows the recoveries rate. Now the number of recovered patients has crossed 15 lakh. It's approaching 16 lakh as we speak. Take a look at this map now. We're starting in March, where the number was almost zero, going all the way up progressively now to almost 16 lakh. Now this shows a consistent increase in the last more than 3 odd months, and the number of recoveries is going up to more than 15 lakh, nearly 16 lakh as on date. Right, now to the next graph that we have prepared for you. That's the number of recoveries per day. That's daily recovered cases. Take a look at this number. Now this shows the period of about 20 days starting 24th July going all the way up to 11th August. And look at the numbers now here. On 24th July, the number of daily recovered cases were about 34,000 and going consistently up to almost 47,000 on 11th August. But it's been hovering between 40 and 50,000 per day and topping at 54,000 on 10th August. That's the daily recovered cases in India. Right, now to the next graph that we have for you. Now this shows the decrease in percentage of active cases and the rise in percentage of recovered cases. Now this is an important graph. Take a look at these numbers, the portion in blue, the portion in red, and the portion in green. The blue shows the decrease in the active cases from 24th March all the way down to 11th August, a consistent decline. Now this is flattening the curve from 24th March till 11th August. This is the blue region. Now take a look at the green zone. Now this shows the rise in recovery, starting from almost 24th March all the way up, and the recovered percent is now more than the number of active cases. Now take a look at this red graph here. That shows the death rate. Now the death rate has fallen from as high as more than 90% on 24th March all the way down to about 30% on the 11th August. So that shows a consistent decline in the number of deaths as well. Right, now to the next graph that we have for you. Now this shows the rising recovery rate, again from 24th March, about less than 10%, all the way up consistently going up all the way to nearly 70% on 11th August. Now that's the highest recovery rate among many countries in the world today. Now to the next graph that we have. Now that shows another metric, and this is the death rate. Now death rate from 18th June all the way down to, guess what, less than 2%, to be precise, 1.99%. From a high of 3.3% on 18th June, July, August, in 3 months, we are down to less than 2%. And Prime Minister Modi says he wants to bring it further to less than 1%. That's the target he has set for his government. Right, so now to another graphic that we have. Now this shows that the early identification of cases have led to a decrease in the active cases of COVID-19. Again, going back to 24th March, March, April, May, June, July, August, 6 months. Now we are down to 28.21% on 11th August. Clearly a big drop in percentage because of the early identification, test, trace, and treat. That's the three-pronged strategy, and that has ensured that the active cases of COVID-19 dropped from as high as 88% in March to less than 30% on 11th August. All right, time for a short break, but when we come back, we'll have a guest over for a discussion in our In Focus segment. Keep watching News Night. Don't go anywhere.
आज जब देश 74वां स्वाधीनता दिवस मना रहा है तो देश के सामने सबसे बड़ा मंत्र है आत्मनिर्भर बनने का। सुदर्शना ने अपने हुनर का लोहा मनवाते हुए कई आकर्षक उत्पाद बनाए हैं। बुनकर ने लकड़ी से सुंदर और आकर्षक बुल्ला कार्ट, छोटी गाड़ियां और अन्य कृषि उपकरण जैसे बुआई मशीन, दराती, पारंपरिक लालटेन, टैगलिंग उपकरण आदि बनाए। दो साथी जोड़ीदारों देवा महतो और अनिल कुमार ने लीज पर 12 एकड़ जमीन लेकर खेती प्रारंभ की है, जिससे वो आत्मनिर्भर बनकर समाज के लिए पथ प्रदर्शक बन सकें।
Welcome back. You're watching News Night on DD India and DD News. Time now for our In Focus segment, in which we're discussing about India's new mantra, trace and treat within 72 hours. Joining me are two very special guests, Dr. V.K. Paul and Dr. Randeep Guleria. Dr. Paul is a member of the National Institution for Transforming India, also known as Niti Aayog. Dr. Guleria is the director of the All India Institute of Medical Sciences in New Delhi. Gentlemen, welcome to News Night. Good to see you again. Let me come to you first, Dr. Guleria. Your thoughts on the news coming in this moment from Russia. Russia says it has a new COVID-19 vaccine ready for use by Russians and other people abroad. What are your thoughts on the Russian claim of having a valid COVID-19 vaccine ready for use?
So if the vaccine is ready, it's great news, but I think what we need to do is make sure about two things, and whether the data is there, that the vaccine is safe, because any vaccine which we start using in a large population, especially the elderly and the high risk group, has to have safety. Safety is paramount for any vaccine because it's going to be given to normal healthy people. And the second issue is that how efficacious is the vaccine in terms of the immunogenicity or the immunity that it gives to an individual. How long does that immunity last? How protective is it? So I think if that data is there and it can be looked at by external experts that the vaccine is safe and it is efficacious, it is good, it gives good immunity, then this is good news. But I would want that that data is critically looked at before we are confident that this vaccine is actually there and can be used at a large scale.
But just a quick follow-up, Dr. Guleria. Now, we are told that whoever develops a vaccine, that vaccine will become a global goods. Now, in that scenario, are we looking at exploring tie-ups with Russia or any other country for that matter, so that more people around the world can benefit and can make use of the vaccine going forward as well?
Yes, I think the vaccine has to be available for all individuals throughout the world, especially those who are at high risk of dying and those who are at high risk of getting the disease, and that has to be prioritized. At the same time, I think it has to be looked at how can, if we find a vaccine which is safe and effective, how can we ramp up production so that very large number of doses are available for the population of the world. And I think that's where India has a big role to play, because 60% of all the world's vaccines are manufactured in India, and we have the capacity to really bring out a large number of vaccines. And therefore, I think if we have a good vaccine, India will play a major role in terms of producing that in bulk so that it can supply to the world.
Absolutely. And that gives me a perfect segue into my question to Dr. Paul. Dr. Paul, as Dr. Guleria pointed out, India manufactures almost 60% of the vaccines supplied globally. Now, India aims to be a pharmaceutical hub in the so-called post-COVID world order. Now, talking about India's track record on research and development of vaccines and COVID-19 vaccine in particular, give our viewers a sense of where the R&D stands today as we speak in terms of clinical trials, human trials and so on, and how quickly can Indians expect to have an indigenously developed vaccine for COVID-19?
Well, India already is the pharmacy of the world, the hub of pharmaceuticals, and also hub of vaccine production, which is a special form of pharmaceuticals, as you can say. So we already are a hub, and we have tremendous capacity to develop vaccines and manufacture vaccines, even if they are developed elsewhere. We have a science enterprise which is very deep, very innovative, very active, and we have several vaccine candidates in the early stage of development. But the three candidates are vaccines are in what you may like to say in advanced stage, relatively speaking. First and foremost, there is this Oxford vaccine, which is made elsewhere. But now one of our companies is going to perform phase 3 trials in human subjects. And already the process has been started, the permission has been granted, and the sites have been identified. So that will be a vaccine which India is, in a way, partly developing. The final phase of development and experimentation is being done in India, and then it will be manufactured by the Indian company, and they already have started to do that work in anticipation. Then we have two other vaccines, which are totally indigenous vaccines, which have entered phase 1, phase 2 human trials, which is a little bit an earlier stage than the vaccine that I referred to earlier. Right. And there is ICMR, Bharat Biotech vaccine, and then there is Cadila, Zydus Cadila vaccine, which is again indigenously developed vaccine. These two are somewhat different from each other, and they are in the stage of phase 1 and phase 2, which is essentially to measure safety and immunogenicity and reactogenicity of the vaccine. And if they succeed in this, which we do hope they would, then we move on to phase 3 in terms of effectiveness and so on. So India is very much in the race on two fronts. One, our own indigenous vaccine. Two specifically are in the stage that we can be excited about. Some others are in the pre-stage compared to this particular timeline. But it is a fact that we will be the manufacturing hub for vaccine, whether it is indigenous or it is produced elsewhere, because we have such a great capacity to manufacture millions of doses of vaccine. So whoever may invent another vaccine, they would look up to India to be able to manufacture this in millions of doses. So India is extremely fortunate, and we are grateful to our industrial enterprise and our scientific enterprise. The timeline cannot be stated in very precise terms. As I said, the stages vaccine development are evident, and yes, it will take, every stage takes some time it is essential because you need to wait for antibodies to develop. We need to wait for effectiveness to be measured after a certain period of time. But yes, in a matter of a few months, the wait should be over, and let's hope that the vaccines would work. Please remember that undue hope and hype should also be avoided, because it is not necessarily certain that every vaccine that we start with would end up as a successful, effective, safe vaccine. Only time will tell. Therefore, we can hope and pray that we will have more than one vaccine developed in India and manufactured in India. But we also have to be mindful that this may not necessarily be true in the immediate, and therefore our disease containment and our addressing the other aspects of pandemic are very, very important. And we must make sure that our behaviors protect ourselves and they protect other people from this pandemic, because that social vaccine, so to say, is already available to us to slow down the spread of pandemic and to be protected. Therefore, there is no lowering of guard in that regard, even as we will have a very rapid, accelerated movement in the direction of vaccine development.
Fair point, Dr. Paul. Now, you had a committee, a 3-member committee, I'm told, in the Niti Aayog, and you will be meeting on Wednesday with all stakeholders, public and private institutions and pharmaceutical companies as well. Could you give our viewers a preview of what they should or should not expect from tomorrow's meeting? And how significant, by the way, is Wednesday's meeting that the committee headed by you will be discussing about?
Well, the government of India has formed a national expert group to look at a very important aspect in relation to vaccine scale-up. See, one aspect is to produce a vaccine and test the vaccine and go through this journey of finding, one or more vaccines that are effective. I've referred to that already. Now, even as that process goes on energetically, we must be also planning as to how, once a vaccine is available, how it will be taken to scale. How we will choose the vaccine, the criteria, how we will make sure that, if it is to be given all across the country, how will the supply, how do we preserve the vaccine if it is to be in a cold chain, for example? How do we identify people who should be the first ones to get the vaccine? Even if, as Dr. Guleria said, the first ones would perhaps be the healthcare providers and frontline workers, and then there will be those who have chronic morbidity. How do you go about doing it? And if the vaccine supplies are relatively limited, how do you prioritize? And also, how do you make sure that there is a follow-up, that the vaccines doesn't show up adverse effects, God forbid. They can still happen in a apparently safe vaccine. So we have to have a post-vaccine follow-up program. We also have to be making sure that, God forbid, if our own vaccines are not enough, for example, then how do we procure them from the market globally? So all these aspects in terms of holistic preparedness to scale up the vaccine, make the supplies happen in the country, and taken supplies to the remotest corner of India, and how to strategically position India in this aspect are the terms of reference of this committee. And tomorrow's meeting would be a very important part of our work. Already a lot of work has already taken place. We are also looking at using digital technology for this endeavor. So multiple work themes are already being worked on, and tomorrow's meeting will give further acceleration to this work. We will be ready in time with our preparation. Once the vaccine is available, we will be in a position to make the best use of it in a most efficient way.
Indeed. Now, let's talk a bit, if you will, Dr. Guleria, about the Prime Minister Modi's meeting with the Chief Ministers of 10 states this afternoon. Now, two things stood out for me, if you ask me. One, the Prime Minister's focus on a new mantra to trace and test within 72 hours of an Indian, anybody coming in contact with an infected coronavirus patient. That's number one. And number two, he says, is asking those 10 states in particular to complement India's three-pronged strategy of trace, test and treat with two more actions containment and surveillance. Now, what should we make of this new strategy, if it's one? And are we prepared to meet any eventuality in these 10 states in particular, so that we actually end up flattening the curve in the next few weeks or months?
So I think what the Honorable Prime Minister has said is very, very important. If we really need to flatten the curve, then these are the states that need to work aggressively.
Right.
And the strategy that has been outlined is something which is what makes real sense and is based on science. And that is that firstly, you have to have a policy of testing, tracing and treating people who are positive and the close contacts within the first 72 hours, so that they don't spread the disease to other members and you don't develop a large cluster of cases. So it's very important that this is done as early as possible. The more you delay it, the more the disease will spread in the community, and you will have more and more cases in of COVID-19 because of the contacts who have come in with these individuals who have not been tested in time. So this whole policy has to be done aggressively. We must also remember that there are some people who are asymptomatic, and therefore if you have a cluster where you are having a large number of cases, you must have a solid containment policy so that even those who are asymptomatic and are there in the community don't spread the disease to others, and you can contain a cluster which is developing so that it doesn't become a huge number of cases in that area. If this is done along with the mantra of COVID appropriate behavior, that everyone aggressively follows wearing a mask, maintaining physical distancing, avoiding crowds or not forming crowds, and regular hand washing, then these three strategies will actually help in flattening the curve and decreasing the number of cases that are seeing a rise in various states. So I think this is what message has come out, and I think this is something which has to be followed in true letter and spirit, that if we do this, that we are able to track and trace everyone who has come in contact within 72 hours. We are able to see where a cluster is developing and develop a very strong containment zone in that area, so that cases are limited to that area and don't leak out to other areas where there are no cases or very few cases, and everyone follows the COVID appropriate behavior policy. I'm sure within the next few days or within a very short span of time, we will start seeing a flattening of the curve and a decrease in the number of cases.
Absolutely. Dr. Paul, one other issue that came out of this afternoon's meeting of the Prime Minister with the Chief Ministers is that his emphasis asking on the states to more in terms of containment and surveillance. At the same time, he says the states could do more on their own to address these issues going forward as well. He, in a spirit of cooperation between the union government and the states in particular, and he seems to suggest that what the government has done in Delhi in particular could be a role model worthy of replication in other parts of the country. What Home Minister Amit Shah, his initiative in attacking the root of the problem in Delhi, and how Delhi could emerge as a potential role model for other cities or states going forward. So your thoughts on what Delhi has done differently than some other parts of the country?
Well, firstly, the Honorable Prime Minister emphasized the fact that all states have made huge efforts. State governments and the union government have worked hand in hand as one team India, and he congratulated and complimented the entire nation and all the states in this regard. And he said that when we're working as a team, we are in a reasonable situation today and we can defeat the virus. And he also emphasized the fact that every state has tried to innovate on the various approaches to contain the disease and in various ways. So he highlighted the fact that the best practices emanating from one state should be celebrated and should be owned up and adapted by other states, so that they don't have to waste time in reinventing the wheel. And there are very fascinating ways, for example, in destigmatizing the COVID disease. So a particular state says COVID Vijeta. Whoever has survived COVID and has come back home is COVID Vijeta. There are COVID clubs that are being talked about, and so on. Similarly, a particular state has used a mobile van to take the services close to people. Another state has used, many states in fact, have used different apps to contain the disease and to provide home care. And states after state introduced pulse oximeters. The point I'm making is there is a plethora of learning and products which can be shared. And the Prime Minister highlighted the need to own this up. And then, of course, as one example, clearly he emphasized that even in a situation that Delhi faced, when things looked very grim, the confidence of the people was shaken, the cases were rising rather exponentially, the death rate seemed to be unacceptable. In that scenario, once as a united team, the state government and the central government and the scientific might of the nation and the teams on the ground and people at large got together, a situation was created in which a concerted effort led to a rapid and a quick decline in the pandemic situation in the country. From 4,000 cases in a matter of days, cases came very close to 1,000. Mortality rate declined, deaths on a given day declined. And then this opportunity led to a much better care, whether it is the home setting or in the COVID care center setting. What your question about what was done is essentially the same thing which Dr. Guleria has highlighted. It was multi-pronged attack, and above all was the emphasis on contact tracing, on containment, on making sure that the surveillance is very intense. The containment zones were redesigned. They were relatively less because a lot of cases were coming from outside the containment zone. So once you increase the number of containment zones, you knew that the whole pandemic could be localized. So the actions were the same which the scientific principles have dictated. The testing was done of people who were coming in contact with large number of people, such as the rickshawala. The zero surveillance was done. Ambulance services were beefed up. Increase in the beds was done. Protocols were followed, and also emphasis on the COVID appropriate behavior.
Absolutely.
And today, drawing from that lesson, the Honorable Prime Minister highlighted that a concerted scientific approach, at the heart of which is containment, contact tracing, surveillance, can turn the corner, and he appealed to all of us that put faith in this and make it happen.
Indeed. So containment and surveillance are the two new action agendas for all the states and union territories across the country to break the chain and beat the coronavirus. All right, on that note, Dr. Paul and Dr. Guleria, thank you so much for sparing time to be on Newsnight and inform our viewers about the latest situation in regards to COVID-19 in the country. Thank you for your time. Appreciate it. Right, moving on. 11th August marked the third anniversary of Vice President M. Venkaiah Naidu's term in office. A book on his achievements was released on the occasion. Here's a report.
Vice President M. Venkaiah Naidu completed 3 years in office on August 11. On this occasion, Defence Minister Rajnath Singh released a book chronicling his 3 years in office of the Vice President of India, titled Connecting, Communicating, Changing at Uparashtrapati Niwas in Delhi. Information and Broadcasting Minister Prakash Javadekar released the electronic version of the book.
The last 1 year since August 2019 has been a mix of hectic public engagements over the first about 8 months, followed by the corona-induced. I spoke at over 70 public events on a range of issues and addressed 14 convocations during this period. The main objective of connecting and communicating with these target groups was to share with them my experiences, my concerns, my worldview, and the way forward for building a new India, strong, stable, prosperous India.
Raksha Mantri Rajnath Singh said that Venkaiah Naidu's 3 years in the office of the Vice President of India should not be seen as his personal achievement, but the achievement for all of us. His speeches are full of emotions which came directly from his heart.
आदरणीय वेंकैया जी ने अपने विचार व्यक्त किए हैं। केवल युवाओं से नहीं बोलते हैं, बल्कि वह दिल से बोलते हैं, और इनके भाषण में इनके भावनाओं की अभिव्यक्ति।
Information and Broadcasting Minister Prakash Javadekar appreciated the popularity of the speeches of M. Venkaiah Naidu.
जो वेंकैया जी जो भाषण देते हैं, अब ये तीसरा खंड प्रकाशित हो रहा है। मैं तो कहूंगा कि सभी कॉलेज के छात्र या जिनको भी अच्छा भाषण सीखना है, अच्छा भाषण करना है, अच्छे संदर्भ जुटाना है, वो अगर केवल वेंकैया जी के भाषणों को फॉलो करेंगे तो भी वो बहुत काबिले तारीफ है।
The book captures through words and pictures the activities of the Vice President, including his travels in India and abroad. It provides a glimpse of his interactions with farmers, scientists, doctors, youth, administrators, industry leaders and artists among others. Rishi Kumar's report, DD India, Delhi.
All right, moving on, there is no let-up in the Bihar flood situation. Nearly 74 lakh people are affected in 16 districts. Now, many rivers are in spate. The death toll, meanwhile, in the landslide at Idukki in Kerala has risen to 52. Now, the Union Food and Consumer Affairs Minister Ramvilas Paswan has appealed the state governments to provide ration to homes in the flood-affected areas.
Floods have wreaked havoc in many parts of the country. Heavy rain has disrupted day-to-day life. Ministry of Consumer Affairs, Food and Public Distribution has come up with a big announcement. Union Minister Ramvilas Paswan has asked the states to arrange door-to-door delivery of ration for the flood victims under the National Food Security Act and Pradhan Mantri Garib Kalyan Anna Yojana. In a tweet, he said that floods have forced many people to leave homes. It is not possible for people to get food grains from ration shops. Flood situation in Bihar remains grim. 16 districts of the state are under the grip of floods. On Tuesday, 1,79,000 cusecs of water was released from Kosi Barrage, while 1,77,000 cusecs of water was discharged from Gandak Barrage in Valmiki Nagar. Around 1,360 gram panchayats have been hit.
अब तक हम लोग 6,69,000 बाढ़ पीड़ित परिवारों को 6,000 दर से कुल 401 करोड़ रुपया का भुगतान हम लोगों उनके बैंक खाते में किया जा चुका है और शेष लोगों का ऑलरेडी चल रहा है और हमारा जो 33 SDRF NDRF टीम है वो रिलीफ का काम देख रहा है.
Many parts of Uttar Pradesh are also affected due to floods. Heavy rainfall occurred at various places during the last 24 hours, and the Met Office has also forecast rain at most places in the state in the next 24 hours. Chief Minister Yogi Adityanath visited Gorakhpur to take stock of the flood situation. The Chief Minister held a meeting with the officials and reviewed the flood situation.
समय के पहले 15 दिन पहले मानसून आया है. भारी बरसात के कारण व्यापक जल जमा हुआ है और मैं आप सबको आश्वस्त करने के लिए आया हूं. अभी प्रारंभिक रूप में हम राहत दे रहे हैं सभी पीड़ित परिवारों को, लेकिन साथ साथ जिन किसान भाइयों को फसल का नुकसान हुआ है उसका भी सर्वे करके इसके बाद उनको भी हम लोग राहत देने का कार्य करेंगे जिससे वे किसान भी इस आपदा से अपने आप को तैयार कर सकें.
In Kerala, the death toll in Idukki landslide has risen to 52. 3 more bodies were recovered from the wreckage. In Pettimudi near Rajmala, NDRF firefighters and police department personnel are engaged in search operations of the missing 19 people. These people have been missing since 7th August. The water level at Mullaperiyar Dam in Idukki district has reached 136.85 feet. The Kerala government on Saturday asked the Tamil Nadu government to release water in a phased manner through the tunnel from Mullaperiyar to Vaigai Dam. In Uttarakhand, the water level of the rivers started increasing due to continuous rainfall in the mountainous regions. The rivers have reached the danger mark. Ganga in Haridwar, Rishikesh and Alaknanda in Srinagar.
All right, take a look at what else is making news around India in our national roundup segment. The BJP on Tuesday fielded Jaiprakash Nishad as its candidate for the by-election to a Rajya Sabha seat from Uttar Pradesh. The by-election is scheduled to be held on August 24. It was necessitated following the demise of Samajwadi Party MP Beni Prasad Verma. The newly appointed president of the Andhra Pradesh unit of the BJP, Somu Veeraraju, officially took charge on Tuesday. Somu Veeraraju is a BJP MLC and hails from East Godavari district of Andhra Pradesh. In Sushant Singh Rajput's death case, the Supreme Court has reserved its verdict in transfer of case from Bihar police to the Mumbai police. After hearing arguments by Riya Chakrabarti's lawyer, Sushant's father's lawyer, the counsel representing Maharashtra government and the Solicitor General of India, the Apex Court asked for a brief written note from all parties by Thursday. The next hearing is on Thursday. Now, holding that daughters cannot be deprived of their right of equality, the Supreme Court on Tuesday ruled that they will have equal co-parcenary rights in a joint Hindu family property even if the father died before the Hindu Succession Amendment Act of 2005.
The Supreme Court has done away with that judgment, has reversed that position of law and has declared that any daughter of a co-parsoner would be entitled to get property rights and on par with that of the son. And I think it's a watershed moment in for the rights of women and rights of daughters. And like the Supreme Court has rightly said, the son remains a son till he gets a wife, the daughter remains for life.
All right, time now for a fact check. The government has clarified that there was no record of the coronavirus in broiler chicken. A fact check team of the Press Information Bureau called a claim in this regard as fake. Now, it was claimed that the novel coronavirus was found in broiler chicken. In another instance, the government said no inquiry has been conducted by the Indian Army into Galwan Valley clash of 15 June. It was claimed by the Economic Times newspaper that the Army has conducted a formal inquiry into the Galwan Valley clash and submitted its report. The Press Information Bureau called it a fake news. Now, another claim circulating on social media said a student of Pondicherry University has found a home remedy for COVID-19 which has been approved by the World Health Organization. Now, this news is fake as well. President Ramnath Kovind has greeted the nation on the auspicious occasion of Janmashtami. In his message, President Kovind said, Lord Krishna has inspired us to establish a society that's sensitive and compassionate. Now, Prime Minister Narendra Modi tweeted his greetings on the auspicious occasion of Janmashtami. In a tweet, the Prime Minister said, best wishes on the occasion of Janmashtami, Jai Shri Krishna, unquote. And that's a wrap, but news continues here on DD India and DD News. You can catch all the latest updates on our social media, mobile and digital platforms. Thanks for watching. Bye-bye.